This is an important question, as anxiety disorders are the most prevalent psychiatric conditions affecting hundreds of million people worldwide, yet we have seen no approvals of drugs developed specifically for any anxiety disorder for decades. Most of such approvals date back to the 1960s and 70s to the benzodiazepines, which target the GABA system and relieve anxiety symptoms rapidly. However, these drugs come with significant side effects, including sedation, dizziness, memory issues, and potential for dependence, which limit their long-term use. And since then, drugs originally developed for depression, for example, mainly SSRIs and SNRIs, have been later approved for anxiety and are now the first-line treatments. These act on serotonin and noradrenaline systems, but often require several weeks to work and can cause gastrointestinal side effects, sleep disturbances, and sexual dysfunction. While effective for many, there is treatment resistance. Around 1/3 of patients do not respond adequately to these medications or to psychotherapeutic interventions, contributing to the chronic nature and the high burden of anxiety disorders. So there is a clear and urgent need for alternative and innovative pharmacological treatments with improved efficacy and tolerability. Beyond refining these serotonergic, noradrenergic, or GABAergic agents, the current research is exploring novel targets on cholinergic, glutamatergic, endocannabinoid, and neuropeptide systems, as well as psychedelics and multimodal drugs. Well, there are several promising candidates already in advanced clinical development now. Novel, rapidly acting anxiolytic drugs target, for example, specific nicotinic receptors in the cholinergic system. Another agent is a neurosteroid that can be given via nasal spray, interestingly, and attenuate, in this case, social anxiety on demand. Also, glutamate interacting agents such as ketamine and cannabinoids like CBD are under investigation in clinical trials for various anxiety phenotypes. Well, another existing area involves the idea to interact with neuroplasticity to produce lasting therapeutic effects without the necessity of chronic treatment, what we're doing now. And this includes pharmacologically enhancing the effects of psychotherapy, for example, on extinction, fear extinction learning in exposure therapy, and among various others, psychedelics are gaining attention here for their potential to reshape brain connectivity and enhance relevant neuroplasticity gained in an appropriate setting. It is also explored whether such neuroplasticity enhancing effects can occur independently of subjective psychedelic experience, the trip, if you like. Additionally, epigenetic drugs, such as HDAC inhibitors, are investigated in this respect, but this is research at early stage so far. So the design of new treatments in this field now increasingly relies on our clearly improved understanding of the neurobiology underlying pathological anxiety. This includes the delineation of affected brain circuits, molecular signaling cascades, receptor systems, and genetic epigenetic regulators. A major challenge remains the ability to pharmacologically normalize then dysregulated anxiety circuitries with a greater specificity than what we can do with current first-line treatments, the antidepressants. Various studies also highlight a significant neurobiological heterogeneity across and within our current anxiety disorder classifications. Thus, a key future goal is to stratify patients based on the underlying neurobiology, paving the way for personalized or precision medicine also now in anxiety. And this shift toward a mechanism-based drug development will depend heavily, of course, on the establishment of reliable biomarkers to identify such patient subtypes, where encouraging progress is made through the integration of peripheral blood markers, genetics, and neuroimaging, but we're not quite there yet. Well, in sum, there is optimism in the field, since considerable progress has been made in diversifying and refining the pharmacological landscape for anxiety disorders. However, significant challenges persist, such as overcoming the considerable treatment resistance, the need for personalized therapeutic approaches, and the translation of neurobiological insights into clinically effective targeted treatments.